Hi, this evening, all about the Omicron variant of the coronavirus. Its scientific name is B.1.1529. The World Health Organization has declared it a variant of concern. It is the first variant to be labeled as such since the Delta variant. First spotted in the Netherlands, then Botswana, and on November 24th, South Africa identified it genomically and reported it to the World Health Organization. Since then, in 1 week, 226 COVID cases caused by Omicron have been detected in 20 countries. I'll leave a list in the description for you. India is not one of them till now, the health minister informed the parliament yesterday, but experts say it is only a matter of time. At this point, I want to give some context and caveats before we proceed. The Omicron variant of the coronavirus has 50 mutations compared to the original Wuhan strain. 32 of these mutations are in the virus's spike protein. This is worrying experts since the spike protein is the part of the virus that attaches itself to human cells and also the part that is targeted by vaccines. But please keep in mind, viruses mutate. It's the thumb rule of how viruses work. Not all mutations survive, not all mutations are strong, some are weaker. Some mutations are more sturdy. Omicron is one such variant. But the fact that the virus mutated into Omicron is not surprising or reason to panic. It has only been a week since South African scientists identified the variant, so many questions still don't have definitive answers. Questions like, does Omicron spread faster? If yes, by how much? All we know till now is that based on past patterns of how the coronavirus behaves, Omicron is likely more transmissible than all previous variants due to its mutations. Experts have also reached this hypothesis based on the fact that a steep surge in new cases in South Africa coincided with Omicron's detection. In just a matter of days, the variant accounted for over 90% of all cases in the country. But even if it is more transmissible, that does not mean it causes more severe COVID-19 or leads to more deaths. Doctors in South Africa who are observing the variant at the epicenter say that COVID-19 cases caused by it are extremely mild till now, with no disproportionate spike in hospitalizations or deaths. Which is to say that it could spread faster than Delta, but it could also be a lot less deadly. How Omicron will affect vaccine efficacy is also not clear. There is a chance that existing vaccines could protect less against the new variant. Almost all big vaccine players from Moderna to Johnson & Johnson to AstraZeneca to Bharat Biotech have begun conducting studies to understand the impact. Many have also begun developing or upgrading their existing vaccines to fight against Omicron, which is reason to be hopeful. Where vaccines would take years to develop, scientists are now working by the week to take in new information and make sure vaccines, our best defense, are updated. Most importantly, there is a consensus among vaccine makers, scientists, and doctors that there is an extremely high chance that existing vaccines will still protect us against severe COVID-19 and death, whether it be Omicron or Delta. Which is to say, the rules to protect yourself and your loved ones are the same. Get vaccinated, wear N95 or 2 masks, wash your hands, don't touch your face, maintain distance when in public, avoid crowded spaces when you can, and ventilate your home if you can. All we need to do is once again increase the dial on how cautious we are with COVID-19 norms. There is no reason to panic about Omicron just yet. More than 50 countries have already implemented travel measures aimed at potentially delaying the import of Omicron. Japan and Israel have completely sealed off borders for new travelers. Most of these travel bans have been imposed against African nations, even though the variant has reached the West and was possibly spotted there first as well. So there is a valid criticism of discrimination to be made here. South Africa, for instance, says it's being punished for having the scientific know-how to have been able to detect Omicron so quickly. India is taking a more measured approach. It was to resume all international flights from December 15th. It is now reviewing that decision. In the meanwhile, all travelers from at risk nations which have bilateral air bubbles with India will be tested upon arrival. They will have to wait at the airport for the results, which could be a 4 to 6 hour wait. If they test positive, they will be quarantined. If they test negative, they have to quarantine at home for 7 days and get tested on day 8 again. The at risk countries are the UK, all European countries, South Africa, Brazil, Bangladesh, Botswana, China, Mauritius, New Zealand, Zimbabwe, Singapore, Hong Kong, and Israel. Travelers from other countries, not at risk, will be randomly tested at the airport as well. If they test positive, 2 week quarantine. If they test negative, they have been advised to monitor their health for 2 weeks at home. States like Maharashtra and Karnataka, which have detected COVID-19 in travelers coming from Africa, have imposed further restrictions and checks. Maharashtra, for instance, now requires you to carry a negative RT-PCR report if you are traveling to the state, irrespective of your vaccination status. All this to say, what used to take us weeks and months earlier, detecting a new variant, sequencing it, sharing that science with other countries, imposing travel curbs, updating vaccines, etc., it's now happening in days. And that's some reason to believe that we will fare better against the new variant. I'll stop here for today. I hope this video made you feel more in control, less panicked, more hopeful. I'll be updating you constantly, just the facts, no noise. Please share this video. Information of this kind is vital at this stage and in public interest. And leave a question or a concern that you may have, and we will address the same for you. If you have been listening, thank you so much for your time.